It's an unfortunate gap that exists where patients with ulcerative colitis may be suffering from urgency or even have accidents and incontinence, and their providers, their doctors and nurses, may not be directly asking about it. When a GI doctor sees a patient with ulcerative colitis, they usually start the interview by saying, "How are you doing?" If the patient says, "I'm doing better," or "I'm doing fine," that's usually where the interview ends and they move on to the next part of their assessment. So if you don't say, "Are you seeing any blood? Are you having any urgency?" the patient may assume that a little bit of blood or a little bit of urgency is okay. Unless you specifically dive in and ask about these specific symptoms, including the very important one of urgency, you're not going to know. When I see a new patient or I make a new diagnosis of ulcerative colitis, and when I see a patient in return visits for follow-up, I go back to the principles of clinical remission. Formed stool, no urgency, no bleeding, sleeping through the night without waking up to have a bowel movement, able to pass gas without fear of leaking. Get in the habit of asking every time about those symptoms, and very importantly, include urgency as part of that.